Hey guys, this is Aaron with Ross Training Academy. Today we're just going to be going over some more common, more basic ACLS and PALS medications. First off, I just want to start by saying follow and know your local protocols and use that when you're out practicing. This lecture is not going to replace your local protocols. It's just going to be kind of a familiarization with these medications. And then remember that medicine is just constantly changing. So going back to just follow your local protocols are probably going to be more up to date with current medicine versus this lecture, depending on when you're viewing this. And then depending on where you go and who you talk to, dosages might be a little bit different. But overall, this lecture will give you some confidence with these medications that we're about to go over. So the first one I want to start with is just oxygen, medical gas. You know, we learn in school just give oxygen to everybody, so it's in this lecture. It increases the body's available oxygen saturation in the hemoglobin to help prevent tissue and cell death. So you're going to use it with hypoxia and hypoxemia, low oxygen levels in the blood and low oxygen levels in the cells. You're going to use it for cardiac arrest, respiratory distress, or arrest, and then low SpO2 levels, or just if a patient's complaining of difficulty breathing, and even if their SpO2 level is fine, you can throw them on just a little bit of a maintenance oxygen just for comfort. So a contraindication is going to be hyperventilation and then the hypoxic drive or the COPDers who normally have lower oxygen levels. Some precautions are going to be normoxia or just 94% on the SpO2 reading, and then open flames. You know, oxygen isn't combustible, but it does aid with combustion. And then the dose for adults and pediatrics, pretty much the same, 2.5 to 15 liters per minute. Just use your best judgment on who should receive what type of dosage. And then some adverse reactions, dry mucous membranes, and then hyperoxia. Normal saline, it's an isotonic solution. It increases the extracellular fluid and increases intravascular space, raising the blood pressure and increasing blood volume. Some indications are going to be hypovolemia and then fluid resuscitation or therapy. Contraindication, there's nothing absolute, but use your best clinical judgment on who should and about how much fluids somebody should get. Some precautions are just going to be heart and kidney failure just because of fluid overload. And then it can increase serum sodium, so just use some caution. The dosage for an adult for resuscitation is just going to be 1 to 2-ish liters. For therapy, you're looking at about 100 to 150 milliliters an hour. You might even hear like just a 250 bolus just to see what happens, right? The pediatric dose for resuscitation is going to be 20 milliliters per kilogram. For therapy, 40 to 70 milliliters per hour. And then that 20 milliliters per kilogram, you might even see that for adults. Some adverse reactions, just edema, metabolic acidosis, and then just fluid overload. So epinephrine is a sympathomimetic. It's just going to simulate the sympathetic nervous system. It's going to stimulate alpha-1 receptors, causing vasoconstriction, stimulate beta-1 receptors, increasing the heart rate and heart contraction, and then stimulates beta-2, that should be 2, bronchodilator. Indications, cardiac arrest, anaphylaxis, hypoperfusion, bronchoconstriction, lots of different times when you can use epinephrine. Contraindications is just going to be hypovolemia. Just, you don't want to constrict blood vessels when there's nothing in them. Some precautions are going to be myocardial ischemia and then hypertension. And MIs can cause and do cause myocardial ischemia. So you have lots of different dosages. For the adult in cardiac arrest, it's going to be 1 milligram every 3 to 5 minutes. Some people still do for the entire resuscitation attempt. Some people now do just 3 doses, so just learn your local protocols. The anaphylaxis or the asthma dose is going to be 0.3 to 0.5 milligrams IM every 5 to 15 minutes. And then your hypotension is just going to be 2 to 10 micrograms per kilogram a minute in an infusion to maintain a blood pressure. And then the pediatric cardiac arrest and bradycardic dose is going to be 0.01 to 0.1 milligrams per kilogram every 3 to 5 minutes. Again, some people use it every 3 to 5 minutes for the entire attempt, or they do a max doses of 3. Learn your protocols. And then for anaphylaxis or asthma, For a pediatric, it's going to be 0.01 milligrams per kilogram or 0.15 milligrams IM every 5 to 15 minutes. Some adverse reactions are just going to be tremors, tachycardia, hypertension, and then just restlessness. You have an onset of about 1 to 5 minutes and then a duration of about 15 to 20 minutes. So norepinephrine, it's a vasopressor. It's going to stimulate alpha and beta 1 receptors. It vasoconstricts and contracts. Indications, you're going to use it for hypoperfusion and shock. Because norepinephrine doesn't increase the heart rate too much, at least in lower doses. You're going to see it more used for like kind of distributive or septic type shocks. Contraindications, just hypovolemia. Some precautions are going to be hypertension and then myocardial ischemia. The adult dose is going to be 0.1 to 0.5 micrograms per kilograms a minute. The pediatric dose is going to be 0.05 to 0.1 microgram per kilogram a minute. Some adverse reactions are going to be hypertension, ischemia, nausea and vomiting, and then restlessness. And you have an onset of about 1 to 3 minutes, and then a duration of 1 to 2 minutes after the infusion is discontinued. Dopamine, an inotropic agent. It stimulates beta 1 and increases cardiac contraction. At higher doses, it stimulates the alpha 1, causing vasoconstriction. You're going to use this for hypoperfusion, cardiogenic, and distributive shock. Contraindications, hypovolemia. Some precautions is going to be sodium bicarb, especially really just in the same line without flushing the line. So it's preferred to just have 2 separate lines, one for your, medications that you're giving for this person, and then one for your infusions, your vasoconstricting vasopressors. And then another precaution is just going to be an ischemic heart, myocardial ischemia. The dosage is going to be about 2 to 20 micrograms per kilogram a minute for an adult and for a pediatric. So 2 to 20 micrograms per kilogram a minute. Some adverse reactions are going to be anxiety, arrhythmias, hypertension, and then restlessness. And then your onset is going to be 1 to 3 minutes, and your duration is going to be about 2 to 5 minutes once the infusion is discontinued. Atropine, an anticholinergic. I like to think of the T as a plus sign in atropine because it increases the heart rate. It is an antagonist to acetylcholine at the muscarinic receptors in the AV node. It blocks those receptors to increase the heart rate, decrease secretions, and then it also causes some bronchodilation. Indications are going to be symptomatic bradycardia and then organophosphate or nerve agent poisoning. Some contraindications are going to be tachycardia, wide complex heart blocks, and then narrow angle glaucoma. Some precautions are just going to be an MI and hypoxia, antihistamines and antidepressants. A couple different doses for an adult. For bradycardia, it's going to be 1 milligram every 3 to 5 minutes for a max of 3 milligrams. And then for poisoning, it's going to be 2 to 5 milligrams. And then you can repeat as needed. For an organophosphate and nerve agent poisoning, you might be getting a lot higher in that milligram dosage, but you're going to start at about 2 to 5 milligrams and repeat until symptoms subside. For pediatrics, the dose is going to be 0.02 milligram per kilogram every 3 to 5 minutes for a max of 1 milligram. For a poisoning for a pediatric, it's going to be 0.05 milligrams per kilogram, and again, just repeat as needed. Some adverse reactions are going to be nausea and vomiting, tachycardia, dizziness, paradoxical and rebound, bradycardia. And then I just went back and added it, but the onset is going to be immediate, and then the duration is going to be about 4 to 6 hours. And then we have heparin. It's an anticoagulant. It binds to antithrombin to block clotting factors and then prevents the formation of clots. So you're going to use it for a STEMI, acute coronary syndrome, ischemic stroke, pulmonary embolisms, and then deep vein thrombosis. Some contraindications are just going to be active bleeding and low platelet count. Some precautions, so somebody who's in an increased risk of bleeding, head trauma, and then liver or kidney failure. The dose for an adult is going to be 70 to 80 units per kilogram, max of 4,000 units, followed by a drip, a maintenance infusion of 10 to 20 units per kilogram per hour for a max of 1,000 units an hour. Heparin is not going to be recommended for pediatrics. Adverse reactions are just going to be bruising, hyperkalemia, GI bleeding. The onset is going to be immediately, and then the duration is going to be about 4 to 8 hours. And then we have aspirin, or a non-steroidal anti-inflammatory drug. It prevents blood clots by blocking formation of thromboxane, and then reduces pain and inflammation. Some indications are going to be MI, acute coronary syndromes, and then angina. Contraindications is going to be bleeding disorders, gastric ulcers, hemorrhagic strokes. So you want to use some precautions with somebody who's at increased risk of bronchospasms, and then liver and kidney disease. The dose is going to be about 162 to 324 milligrams. If somebody's having an MI or you believe that they are, you typically start at the 324 milligrams. And then aspirin is not recommended for pediatric patients. Some adverse reactions are going to be nausea and vomiting, stomach upset, GI bleeding, and then Reyes syndrome. You guys should look into Reyes syndrome. It's not really known too much about. It's a pretty cool phenomenon, actually. And then we have our onset of 10 to 20 minutes, and then duration of 3 to 6 hours. Then we have nitroglycerin. It's a vasodilator. It causes relaxation and dilation of the coronary arteries, reducing myocardial oxygen demand, and then improving blood flow from the dilation. Some indications are going to be MI, ACS, angina, hypertension, and then pulmonary edema. Some contraindications are going to be intracranial bleeding, erectile dysfunction medications within the last 24 to 72-ish hours, hypotension, and then right ventricular MI. Some precautions are just going to be tachycardia or even bradycardia. The dose is going to be 0.4 milligrams every 3 to 5 minutes for a max of 3 doses. And then this is not recommended for the pediatric patient. An adverse reaction is going to be headache, dizziness, nausea and vomiting, hypotension, tachycardia, and even syncope. The onset is going to be 1 to 3 minutes, and then the duration is going to be 20 to 30 minutes. Adenosine. It is a class 5 antiarrhythmic. It activates potassium channels and inhibits calcium influx, blocking the AV node, temporarily stopping the heart for a reset. It's indicated for SVT. It's contraindicated for AFib, VTAC, A-flutter, second or third degree heart blocks, drug-induced tachycardias, and then sick sinus syndrome. Precautions, just going to be underlying respiratory or cardiac conditions, and then the dose is going to be 6 to 12 milligrams rapid, followed by 12 milligrams if needed. A lot of places are starting to move towards that 12 milligrams followed by 12, but just learn your local protocols. The pediatric dose is going to be 0.1 milligram per kilogram, max of 6 milligrams rapid, and then followed by 0.2 milligrams per kilogram for a max of 12 milligrams. I do have this little saying, it's just add more Narcan Zofran, and then just throw in Versed. So add more Narcan Zofran Versed. And those are going to be all of your, well, most of your 0.1 drugs for the pediatric patient. So adenosine, morphine, Narcan, Zofran, and Versed, 0.1 milligrams per kilogram for the pediatric patient. And then adverse reaction, you have dyspnea, dizziness, bronchospasm, palpitations, and hypotension. The onset is going to be immediate, and then the duration is going to be about 10 seconds. So push it fast, flow it in, flush it in. And then we have amiodarone. It's a class 3 antiarrhythmic. It's a potassium channel blocker. It blocks sodium, potassium, and calcium channels, prolonging the cardiac action potential, allowing for repolarization. So contraindications are going to be cardiac arrest, VFib, and then VTAC with a pulse. Contraindications, cardiogenic shock, sick sinus syndrome, second or third degree heart block. Some precautions are going to be hypotension and lactating women. Again, just precautions, right? The dosage for cardiac arrest for an adult is going to be 300 milligrams bolus. Then in 3 to 5 minutes, give 150 milligrams. And then if somebody has a pulse with VTAC, the dose is going to be 150 milligrams in an infusion over about 10 minutes with an absolute max, or I shouldn't say absolute, with a max of 2.2 grams. So for the pediatric patient in cardiac arrest, it's going to be 5 milligrams per kilogram bolus every 3 to 5 minutes for a max of 15 milligrams per kilogram. And then for VTAC with a pulse for the pediatric, 5 milligrams per kilogram over 10 minutes with a max of 15 milligrams per kilogram. Adverse reaction is going to be bradycardia, hypotension, and then prolonged QT interval. The onset is going to be 1 to 2 minutes, and then the duration is going to be 30 to 40 days. And then lidocaine, it's a class 1B antiarrhythmic, sodium channel blocker. It blocks sodium channels at the ventricle level and then raises the VFib threshold. So you're going to use it for cardiac arrest, VFib, pulseless VTAC, and then VTAC with a pulse. Some contraindications: bradycardia, MI, second or third degree heart block. Precautions: underlying cardiac conditions, and then your electrolyte imbalance. The adult dose for cardiac arrest is going to be 1 to 1.5 milligrams per kilogram as a bolus, and then in 3 to 5 minutes, half that dose for a max of 3 milligrams per kilogram. Somebody with a pulse, VTAC with a pulse, 1 to 1.5 milligrams per kilogram bolus, and then a maintenance of 1 to 4 milligrams a minute. And then for the pediatric patient in cardiac arrest, 1 to 3 milligrams per kilogram, max of 100 milligrams, and then repeat every 3 to 5 minutes for a max of 3 milligrams per kilogram. And then pediatric with a pulse, 1 milligram per kilogram bolus, followed by 20 to 50 micrograms per kilogram a minute. Infusion. Some adverse reactions are going to be hypertension, bradycardia, and seizures. The onset is going to be 1 to 3 minutes, and then the duration is going to be 20 to 60 minutes. Then we have prochiamide. It's a class 1 antiarrhythmic. It is kind of going out of favor, but you still might hear it. You still might see it around. It blocks sodium channels in the cardiac cells, decreasing rate of depolarization and prolongs the action potential. It's going to be indicated for VTAC, SVT refractory to adenosine. I spelled that completely wrong, but adenosine. AFib RVR with Wolff-Parkinson's-White syndrome. Contraindications are going to be torsades, second or third degree heart block, and then digitalis toxicity and heart failure. And then you just want to use caution for somebody with liver or kidney disease and then hypotension. The adult dose is going to be 20 to 50 milligrams a minute infusion for a max of 20 milligrams per kilogram, and then a maintenance drip of 1 to 4 milligrams a minute. For a pediatric, 15 milligrams per kilogram infusion, maintenance drip of 20 to 80 micrograms per kilogram a minute. Some adverse reactions are just going to be like nausea and vomiting, bradycardia, prolonged QT intervals, hypotension. The onset is going to be 10 to 30 minutes, and then the duration is going to be 3 to 6 hours. Magnesium sulfate is an electrolyte, anticonvulsant, and a bronchodilator. Its action is a calcium antagonist. It restores normal heart rhythms, and then it's also a smooth muscle relaxer. It's going to be indicated for torsades, eclamptic seizures, status asthmaticus, and then hypomagnesemia. Contraindications, so like heart blocks, hypotension, myocardial damage. Precautions, it can exacerbate muscle weakness, and then respiratory depression as well. The dose is going to be 1 to 4 grams titrated to effect for an adult, and then for a pediatric, 25 to 50 milligrams per kilogram, titrate to effect. Adverse reaction is going to be drowsiness, hypotension, bradycardia, electrolyte imbalance, and then respiratory depression. The onset is going to be 1 to 2 minutes, and then a duration of 30 to 45 minutes. Diltiazem, cardizem, is a class 4 antiarrhythmic. It's a calcium channel blocker. It inhibits calcium channels and then slows the conduction through the AV node. It's going to be indicated for AFib RVR and aflutter RVR. Some contraindications are going to be VTAC, Wolff-Parkinson's-White syndrome, and sick sinus syndrome, cardiogenic shock, and hypotension. You want to use precautions with heart failure. It may react negatively with beta blockers as well. The dose is going to be 0.25 milligrams per kilogram for a max of 20 milligrams, followed by 0.35 milligrams per kilogram with a max of 25 milligrams after about 15 minutes. And then this is not going to be recommended for the pediatric patient. Adverse reaction is going to be headache, hypotension, palpitations, peripheral edema, and then bradycardia. Onset is going to be about 2 to 5 minutes, and then the duration is going to be 1 to 3 hours. Metoprolol, it's a class 2 antiarrhythmic or a beta blocker. It's a selective beta 1 adrenergic receptor blocker. decreases the heart rate, blood pressure, and then myocardial oxygen demand. So you're going to use it for an acute MI, hypertension, AFib RVR, A-flutter RVR, and then even SVT. It's contraindicated for hypotension, cardiogenic shock, heart failure, and bradycardia. Some precautions is it impairs sinus node function, so use caution with sick sinus syndrome. So the dose is going to be 5 milligram bolus, may repeat in 5 to 10 minutes for a max of 15 milligrams. Adverse reactions, so like nausea, vomiting, hypotension, bradycardia, and then dyspnea. You have an onset of 1 to 3 minutes and then a duration of 3 to 4 hours. And then we have calcium chloride. It's an electrolyte and a hypertonic solution. It increases calcium ions, increases myocardial contraction force, and then ventricle automaticity. You're going to use it for hypocalcemia, cardiac arrest, calcium channel blocker and beta blocker overdose, hypermagnesemia, I can't say that word, hyperkalemia. Contraindications is going to be hypercalcemia, digitalis toxicity, and then VFib. Precautions, underlying cardiac conditions, and then digoxin. Your dose is going to be 0.5 to 1 gram bolus, and then you may repeat in 3 to 5 minutes. Typically, you'll just start at that 1 gram bolus for an adult. And then pediatrics is going to be 20 milligrams per kilogram bolus for a max of 1 gram, and then you can repeat in 3 to 5 minutes. Some adverse reactions are going to be nausea and vomiting, hypotension, bradycardia, and then tissue necrosis at the IV site. So just make sure you have a patent line and then flush it following the bolus. You have an onset of 1 to 3 minutes and then a duration of 20 to 30 minutes. Sodium bicarb, it's an electrolyte and an alkalizing agent. It raises the body pH to treat metabolic acidosis. So you're going to use it for cardiac arrest, hyperkalemia, metabolic acidosis, TCA overdose, crush injuries, and then rhabdomyolysis. Some contraindications are going to be hypokalemia, alkalosis, vomiting, hypernatremia, and then hypocalcemia. Some precautions, hypertension, pulmonary edema, and then heart failure. The dose for an adult and a pediatric is going to be 1 milliequivalent per kilogram bolus, and then you could repeat that in 5 to 10 minutes. Adverse reaction, alkalosis, hypokalemia, peripheral edema, seizures, tissue irritation, and then you have an onset of 1 to 2 minutes and a duration of 10 to 15 minutes. Furosemide, it's a loop diuretic. It increases secretions of sodium, chloride, and water, causing decreased fluid volume. You're going to use it for pulmonary edema and heart failure. Contraindications, hypovolemia, and then hepatic coma. You're going to use precautions for hypotension and electrolyte imbalances. The adult dose is going to be 0.5 to 1 milligram per kilogram, and you can repeat in 15 to 30 minutes for a max of 80 milligrams. And then for a pediatric, 1 milligram per kilogram bolus, repeat in 15 to 30 minutes for a max of 6 milligrams per kilogram. Some adverse reactions are going to be dizziness, nausea, vomiting, hypotension, hyperglycemia, and electrolyte imbalance. You're going to have an onset of about 5 to 10 minutes and then a duration of 4 to 6 hours. And then these last few medications, they aren't necessarily going to be used for ACLS and PALS exactly. They're just going to be more for like comfort, for when you're doing like transcutaneous pacing or, synchronized cardioversions, or even somebody who's having some chest pain from an MI or suspected MI. So this one here is going to be fentanyl. It's an opioid analgesic. It binds to the opioid receptors, causing analgesic and sedative type effects. You're going to use it for moderate to severe pain and then for procedural sedation. Contraindications is going to be CNS and respiratory depression, hypotension, muscle weakness. Some precautions are just going to be head injuries, as it can raise intracranial pressure, and then just opioid addictions, right? The dose for an adult is going to be 1 to 3 micrograms per kilogram, may repeat in 5 to 10 minutes for a max of 300 micrograms. Then for the pediatric, 0.5 to 1 microgram per kilogram, can repeat in 5 to 10 minutes for a max of 3 micrograms per kilogram. Adverse reaction, drowsiness, chest wall rigidity, respiratory depression, hypotension, and then bradycardia. You're going to have an onset of about 1 to 2 minutes and then a duration of 30 to 60 minutes. Morphine. It is also an opioid. It's going to bind to the opiate receptors, causing analgesic and sedative effects. It can cause peripheral vasodilation, decreasing systemic vascular resistance and blood pressure. You're going to use it for moderate to severe pain and then angina, that mona, phona mnemonic. Contraindications are going to be head injury, increased ICP, hypotension, hypovolemia. You want to use precautions with decreased respiratory functions and then substance abuse or addictions. The adult dose is going to be 2 to 5 milligrams bolus, and then you can repeat in 5 to 15 minutes for a max of 15 milligrams. The pediatric dose is going to be 0.1 to 0.2 milligrams per kilogram bolus. Repeat in 5 to 15 minutes for a max of 10 milligrams. Some adverse reactions are going to be drowsiness, nausea, vomiting, bradycardia, hypotension, respiratory depression. You're going to have an onset of 3 to 5 minutes and then a duration of about 2 to 5 hours. And then we have midazolam, or Versed. It's a benzodiazepine, anticonvulsant, and a sedative. It's going to bind to GABA receptors in the central nervous system, reducing excitability of neurons and then raising the seizure threshold. It's going to be indicated for seizures and then procedural sedations or even maintenance sedation after RSI. Contraindications are going to be shock and coma, narrow angle glaucoma, CNS and respiratory depression. Some precautions are going to be muscle weakness, hypotension, and then ETOH or alcohol may worsen the sedation effect. The dose is going to be 2 to 5 milligram bolus, and then you can repeat that in 5 to 10 minutes for a max of 10 milligrams for an adult. For a pediatric, it's going to be 0.1 to 0.3 milligrams per kilogram bolus. You can repeat that in 5 to 10 minutes for a max of 10 milligrams. Adverse reaction, so you're looking at drowsiness, nausea and vomiting, respiratory depression, and hypotension. And then onset of 1 to 3 minutes, and then 2 to 4 hours for the duration. And that's it. That's your drugs. That's your medications. Of course, keep doing more research into these medications. This is a very basic lecture about your medications, but it does give you that good information that you're going to need to know. Of course, always follow your local protocols, and remember that medicine is constantly changing, so just never stop learning. But that's it for this video. Please like, comment, subscribe, share,